certain camps established connections with American universities that could only be described as remarkable given the circumstances. A report compiled regarding Camp Butner in April of 1945 documented that 110 prisoners were employed as mess attendants at Duke University and the University of North Carolina. While these particular prisoners were working in non-medical capacities, serving food rather than practicing medicine, the university connection nonetheless provided German medical personnel housed in the camp with unprecedented access to the world of American academic medicine. These university connections, though limited in scope, represented a level of integration between enemy prisoners and American institutions that would have been absolutely unthinkable under the Nazi German system. As the United States committed millions of soldiers to overseas deployment, the resulting labor shortage on the home front eventually necessitated using German prisoners of war to help support the war effort. These men found themselves working in canneries, mills, farms, and other locations deemed to present minimal security risks. For those with medical training and credentials, this often translated to working in hospitals and medical facilities where their professional skills could be put to practical use. German medical officers who volunteered to perform medical work received compensation according to their rank and position, exactly as the Geneva Convention required. While the payment remained modest in absolute terms, it represented something more significant than money. It constituted recognition of their professional status, and this profoundly affected men who had steeled themselves to be treated as defeated enemies deserving only contempt. A different sort of challenge emerged from the increasing numbers of German prisoners of war flowing into American custody. Initially, some nurses questioned whether they possessed the emotional capacity to set aside their personal feelings and provide these enemy soldiers with the highest quality care available. Moreover, official theatre hospital policy explicitly placed the care of Allied casualties above that offered to enemy prisoners. Most nurses, however, discovered quickly that they were fully capable of viewing these men simply as patients who required care, and they treated Germans no differently than they treated anyone else. This professional integration occurred despite initial reservations and despite official policies that prioritized Allied casualties. The ability demonstrated by American medical personnel to separate their professional duties from national enmity provided German medical officers with a living model of medical ethics that transcended political ideology. German medical personnel stationed in American camps witnessed an abundance of medical supplies that directly contradicted their experience of wartime scarcity. Basic medical necessities including bandages, medications, and surgical instruments were available in quantities that German military medicine had not seen since before the war began. The pharmaceutical availability particularly impressed German medical personnel who had grown accustomed to careful rationing. Sulfur drugs, which had been meticulously rationed in German military medicine and used only when absolutely necessary, were employed liberally and without apparent concern for conservation. The introduction of penicillin to some facilities by 1944 represented a therapeutic capability that German medicine completely and utterly lacked. This new antibiotic, still in its early stages of mass production, was already being used in American facilities, while German doctors had only heard rumors of its existence. The medical treatment provided to German prisoners of war met or exceeded the standards maintained for American military personnel. German wounded received the same surgical procedures, the same medications, and the same rehabilitation services as American soldiers. This equality of treatment, mandated by the Geneva Convention but frequently ignored in practical application by many belligerent nations, was consistently applied throughout American facilities. German medical officers both observed and participated in this equal treatment standard, gaining invaluable experience with American medical protocols and ethical standards that would exert influence on their post-war medical practice for years to come. Texas hosted numerous prisoner of war camps, creating a significant concentration of German prisoners, including substantial numbers of medical personnel. Camp Butner, located on approximately 40,000 acres spanning 63 square miles across Granville, Person, and Durham counties, functioned as a combat infantryman training facility and site for training exercises that prepared an estimated 30,000 soldiers. German and Italian prisoners of war were brought to Camp Butner, where they served as cooks and performed various duties supporting camp operations. The scale of these facilities and their medical components provided German medical officers with extensive exposure to American military medicine at its most fully developed state. The contrast with the increasingly desperate conditions back in Germany became more stark and undeniable as the war progressed and news filtered through about the deteriorating situation in the homeland. The professional relationships that developed between American and German medical personnel, while necessarily constrained by the fundamental prisoner-captor relationship, nonetheless included genuine professional exchange and mutual learning. American doctors learned trauma treatment techniques from German colleagues who had accumulated extensive battlefield experience during years of combat across multiple fronts. German doctors, in turn, learned about American advances in antibiotics, anesthesia, and surgical techniques that represented significant improvements over previous methods. These exchanges, documented in post-war accounts and preserved military records, represented a level of professional collaboration between enemies that was unprecedented in the entire history of modern warfare. Local soldiers had trained in American military medicine, and this training provided German personnel with insights into fundamentally different approaches to medical care and organization. American nurses possessed more authority and autonomy than their German counterparts, participating actively in medical decision-making and performing procedures that in Germany were strictly reserved for physicians. German medical officers working alongside American nurses had to adjust to this different professional hierarchy, an adjustment that challenged their deeply held assumptions about how medical practice should be organized and who should hold what responsibilities. This exposure to a different model of professional relationships would influence how some of these officers thought about medical organization when they eventually returned to Germany. During the Second World War, space at Fort Sam Houston was made available to accommodate up to 1,000 German prisoners of war. This arrangement took place beginning on the 15th of September 1942, serving as a temporary measure while permanent prisoner of war camps could be constructed. Fort Sam Houston is known throughout military circles as the home of Army medicine and the home of the combat medic, giving it special significance in military medical history. Fort Sam Houston's role as a major medical training facility meant that German medical personnel stationed there gained exposure to American military medical education and training methods. While their participation remained limited due to security concerns, their observation of American medical training provided valuable insights into different approaches to medical education that emphasized practical skills and systematic instruction. Dental care in prisoner of war camps, an aspect often overlooked in historical accounts of the period, provided another important avenue for professional interaction between American and German medical professionals. German dentists among the prisoners of war worked in camp dental facilities, maintaining oral health for thousands of prisoners under their care. These dental officers experienced the same professional recognition as their physician colleagues. The American investment in prisoner of war dental health extended beyond emergency services and extractions to include routine dental care and preventive treatment. This commitment to comprehensive prisoner welfare actually exceeded the requirements established by the Geneva Convention, demonstrating an approach to prisoner treatment that went beyond minimal legal obligations. German medical officers participated actively in public health measures within the camps, including disease prevention, sanitation supervision, and health education initiatives. These activities exposed them to American public health approaches that emphasized prevention over treatment, a philosophical orientation that contrasted notably with German military medicine's predominant focus on battlefield trauma and acute care. The success of these public health measures in maintaining camp health, despite crowded conditions that might otherwise breed disease, provided practical demonstrations of American preventive medicine's effectiveness. The American approach to mental health treatment particularly affected German medical personnel who observed it. Combat fatigue, what would later be termed post-traumatic stress disorder, was recognized and treated as a legitimate medical condition rather than dismissed as cowardice or moral weakness, which was the prevailing view in German military medicine. German psychiatrists and psychologists among the prisoners of war observed treatment methods that included psychotherapy, occupational therapy, and pharmaceutical interventions working in combination. This comprehensive approach to mental health contrasted sharply with German military psychiatry's punitive approach to psychological casualties, which often treated mental breakdown as a failure of will rather than a medical condition deserving treatment. As the war drew to its conclusion, German medical personnel faced the prospect of repatriation to a homeland that had been destroyed. Many had spent 2 or more years in American custody, during which period they had practiced medicine under conditions that often surpassed what they had known as free physicians in Germany before the war. The repatriation process included medical examinations and health certifications conducted jointly by American and German medical personnel, creating one final professional collaboration that reinforced the collegial relationships that had developed during the years of captivity. Following repatriation, approximately 5,000 Germans chose to emigrate to the United States, and thousands of others returned later to visit the country where they had been held prisoner. Many American farmers recalled their prisoner of war laborers with genuine admiration and even affection, speaking positively of the German prisoners who had worked their fields. Indeed, many farmers maintained warm friendships with former prisoners that lasted for decades. Among these maintained relationships were professional connections between medical personnel who had worked together during the war years. German medical officers who returned to Germany brought with them extensive knowledge of American medical practices, organizational methods, and ethical medical standards. While the precise influence proves difficult to quantify with certainty, their impact on post-war German medicine was significant, particularly in areas such as medical ethics, patient rights, and professional standards. The exposure German medical personnel received to American medical education methods influenced the reconstruction of post-war German medical training in measurable ways. The emphasis on practical clinical experience, the integration of basic science knowledge with clinical practice, and the systematic approach to resident training were all elements that returning German medical officers advocated for in rebuilt German medical schools. Several German medical officers who had experienced American captivity became prominent medical educators in post-war Germany, though connecting their teaching methods directly to their prisoner of war experience remains historically challenging without access to personal papers and institutional records that might document these connections explicitly. The experience of German prisoner of war medical personnel in America is documented through various sources that historians have pieced together. Official military records preserved in the National Archives provide administrative details and policy information. International Red Cross inspection reports offer independent assessments of camp conditions and treatment. Post-war memoirs and oral histories provide personal perspectives from those who lived through the experience. Contemporary newspaper accounts capture how events were perceived at the time. Camp newspapers published by prisoners of war themselves offer unique insights into prisoner perspectives and concerns. These sources, while providing valuable insights into this historical episode, nevertheless leave many questions unanswered about the full extent of professional relationships and knowledge transfer that occurred during this period. German pharmacists and pharmacologists among the prisoners of war gained valuable exposure to American pharmaceutical practice, including mass production techniques, quality control standards, and distribution systems that operated at scales unknown in Germany. This knowledge proved valuable in rebuilding Germany's pharmaceutical industry after the war ended. The availability of medications in American camps, ranging from basic aspirin to advanced antibiotics, demonstrated production capabilities that exceeded anything the German pharmaceutical industry had achieved. This exposure to American pharmaceutical abundance influenced German medical personnel's understanding of what modern medicine could achieve when provided with adequate resources and industrial capacity. The exchange of surgical knowledge between American and German medical personnel represented one of the most practical aspects of their professional interaction during the war years. German surgeons, many possessing extensive battlefield experience accumulated over years of combat medicine, shared trauma treatment techniques developed through direct experience with military wounds. American surgeons, benefiting from their own advances, shared improvements in anesthesia, aseptic technique, and post-operative care protocols. This bidirectional knowledge transfer, while necessarily limited by language barriers and security constraints that governed all interactions, nonetheless enriched both medical communities and contributed to improved outcomes for patients on both sides. German medical technologists and laboratory specialists among the prisoners of war worked in camp laboratories, conducting routine diagnostic tests and supporting overall camp medical operations. These personnel gained hands-on experience with American laboratory methods, equipment, and quality control standards that often exceeded German military medical laboratory capabilities. The systematic approach to laboratory medicine evident in American facilities, including standardized procedures, regular equipment maintenance schedules, and comprehensive record-keeping, provided working models for post-war German laboratory medicine development that would influence how German laboratories operated for years to come. German radiologists and X-ray technicians among the prisoners of war operated American radiology equipment during their captivity. American radiology equipment, particularly its reliability and image quality, impressed German personnel who had grown accustomed to maintaining deteriorating equipment with increasingly scarce replacement parts. Safety protocols in American radiology practice, including radiation protection measures designed to protect both patients and operators, exceeded German military medical standards that had paid less attention to long-term radiation exposure risks. This exposure to comprehensive radiation safety influenced post-war German radiology practice as returning specialists advocated for similar safety measures. The prisoner of war camps facilitated communication between German medical personnel and international medical communities, maintaining some degree of connection to broader medical developments even during wartime. Many prisoner of war camps published newspapers written by and for prisoners. These publications, subject to American censorship, but generally allowed considerable freedom in their content, included medical and health content written by German medical personnel. These articles covered topics including health education, disease prevention, and medical nutrition. The newspapers provided medical personnel with platforms to maintain their professional identity and share knowledge with fellow prisoners. The newspapers, preserved in various archives, provide valuable insights into German medical personnel's perspectives on their experience and how they processed what they were learning. While limited in scope, some German medical personnel were permitted to conduct medical research during their time in American captivity. This research focused on non-sensitive topics such as nutritional deficiencies among prisoners of war or disease patterns in camp populations, topics that posed no security threat. The opportunity to conduct even limited research with access to laboratory facilities and statistical support exceeded what many German medical researchers had available in wartime Germany's deteriorating research infrastructure. This ability to maintain research skills proved valuable when these scientists and physicians returned to Germany and began rebuilding medical research programs. Disease outbreaks in prisoner of war camps required coordinated medical responses that brought American and German medical personnel together in urgent collaboration. These epidemic responses, whether addressing influenza, gastrointestinal infections, or other communicable diseases, demonstrated American epidemic control methods and public health responses in action. German medical personnel participated actively in these responses, gaining practical experience in epidemic investigation, containment measures, and mass treatment protocols that would prove valuable in post-war Germany's challenging public health conditions, where disease outbreaks threatened populations weakened by malnutrition and displacement. German medical officers observed American medical supply management systems that ensured consistent availability of medical materials regardless of external circumstances. The systematic approach to inventory management, maintenance of emergency stockpiles, and efficient distribution networks provided working models for effective medical logistics. This exposure to American medical supply chain management influenced German medical officers' understanding of how modern medical systems could maintain consistent supply even under challenging conditions, knowledge that proved valuable when rebuilding German medical infrastructure after the war. Treatment of combat wounds in camp hospitals exposed German medical personnel to American advances in wound care that represented improvements over previous methods. The liberal use of antibiotics to prevent infection, advanced surgical debridement techniques that removed damaged tissue while preserving viable tissue, and systematic approach to wound documentation all represented advances over German military medical practice. German medical personnel's observation of and participation in American wound care protocols influenced post-war German trauma medicine, contributing to improved outcomes for civilian trauma victims in rebuilt German hospitals. American emphasis on preventive medicine in prisoner-of-war camps exposed German medical personnel to a different medical philosophy than they had previously encountered. Routine health screenings, vaccination programs, and health education initiatives demonstrated prevention-focused medicine's effectiveness in maintaining population health. This preventive approach, while not entirely unknown in German medicine, had received lower priority in German military medicine that focused predominantly on treating battlefield trauma. Exposure to comprehensive preventive medicine programs influenced German medical personnel's post-war practice as they incorporated these approaches into their work. American rehabilitation medicine for wounded soldiers particularly impressed German medical personnel who observed these programs. The emphasis on returning wounded soldiers to maximum possible function, rather than simply pensioning them as permanent invalids, represented a fundamentally different approach to disability. German medical personnel observed physical therapy, occupational therapy, and vocational rehabilitation programs that exceeded anything available in German military medicine. This exposure influenced post-war German rehabilitation medicine development as returning medical officers advocated for similar programs in rebuilding German medical facilities. American medical communication methods, including communication between professionals, communication with patients, and documentation practices, differed notably from German practices in ways that German medical personnel observed. The emphasis on clear documentation, patient education, and interdisciplinary communication provided models for effective medical communication that improved care quality and coordination. German medical personnel's exposure to these communication methods influenced their post-war practice, contributing to more patient-centered and collaborative medical care in rebuilt German medicine, as these officers took positions in post-war medical institutions. The experience of German prisoner-of-war medical personnel in American captivity demonstrates conclusively that professional identity can transcend national enmity even during wartime. The American Medical Corps' treatment of captured German physicians as respected colleagues, professionals with whom they freely taught and learned different medical procedures, established relationships that outlasted the war and influenced post-war medical practice. While the full extent of knowledge transfer and professional relationships remains incompletely documented in historical records, available evidence confirms that German medical personnel experienced professional recognition that exceeded their expectations and, in many documented cases, exceeded their previous experience in German military medicine before capture. This professional treatment was neither universal nor without problems and limitations. Security constraints necessarily limited some interactions. Language barriers prevented full communication in many cases. The fundamental prisoner-captor relationship imposed inherent limitations on how fully professional integration could proceed. Some American medical personnel maintained professional distance, unwilling or unable to fully embrace enemy doctors as colleagues. Some German medical personnel resisted American approaches, remaining committed to German medical traditions and suspicious of American methods. Nevertheless, the documented experience of German prisoner-of-war medical personnel in America represents a remarkable chapter in military medical history that deserves continued study and attention. The decision to treat enemy medical personnel as professional colleagues reflected both American adherence to international law under the Geneva Convention and fundamental American medical values that emphasized professional respect and collegial relationships. The impact extended beyond individual German medical officers to influence post-war German medicine more broadly. While direct causation proves difficult to establish with certainty through historical evidence, German medical officers who experienced American medicine during captivity contributed to post-war German medical reconstruction, bringing knowledge of American methods, ethics, and organizational approaches that influenced how German medicine developed in the post-war period. The story of German prisoner of war medical personnel in America ultimately demonstrates medicine's capacity to maintain professional bonds even during the most intense periods of warfare between nations. In treating enemy medical personnel with professional respect and collegial regard, American military medicine not only adhered to its obligations under international law, but also demonstrated values that transcended the immediate conflict. This historical example remains relevant for contemporary military medicine and international medical relations in ways that continue to resonate decades later. The principle that medical professionals share obligations that transcend national boundaries, a principle demonstrated concretely in American treatment of German prisoner of war medical personnel, continues to guide military medical ethics and international medical cooperation in the present day. The German medical officers who experienced American collegiality rather than the enmity they had expected returned to Germany carrying more than just medical knowledge and technical skills. They carried with them the lived experience that professional respect could survive even the crucible of total war, that medical ethics transcended political ideology and national allegiance, and that former enemies could become colleagues in medicine's universal mission of healing the sick and injured regardless of nationality or political affiliation. This legacy of professional respect across enemy lines represents one of the more hopeful stories emerging from the devastation of the Second World War.